Our department actually began long before the concepts of family medicine even evolved. I had never heard of family medicine. It wasn't recognized as a specialty until 1969. And so we started on April Fool's Day, 1967. It was a brand new medical school, just in its third year of operation. The dean, Fitz, at that time created a new department called epidemiology and community medicine. He wanted to branch the school outside into the state, wanted to get outside of the walls of the university, and that was the community medicine part. He brought in an internist who had been trained as an epidemiologist, Bob O'Season. And Bob was a superb guy, and he was interested in carrying the medical school throughout the state of New Mexico, and he did that. Some of the early program, after he came on, he wanted to do some research, so I hired Betty Skipper, who just retired as one of our longest tenured faculty. And Betty made some early contributions. He hired some nurses, nurse educators, and one of the first outreach programs was to start a nurse practitioner training program. Which was how I actually got involved in the department. I was a fellow. I'm older than family medicine, and I don't admit this in public much, but I had done an internal medicine residency, been chief resident, and did a fellowship. During my fellowship, the dean, Bob Stone, and Bob O'Season called me and said, "We have a nurse practitioner out in Estancia. You've had a lot of broad general practice training and experience. Will you just carry a beeper and be our backup?" So during my fellowship, I carried a beeper, and Martha and I talked multiple times a day as her backup. And that was a lot of fun. And I got to know the people in the department, and it led to a natural segue. But I think one of the early contributions was the fact that this department has had a focus on getting out of the walls of the medical school, doing innovative things, doing creative things. Because being a nurse practitioner, this was not long after Duke and the PA programs and the early physician assistant programs were getting started. And we were on the cutting edge of that as well. Programs. In those early days, Bob hired a guy named Ham Brown, who wrote a grant and got a large grant to start some community-based clinics in the North and South Valleys in Albuquerque. Those are now our first choice clinics. Mm-hmm. So those started out of our department. And so those for the healthcare for the homeless started out of our department, out of one of my own projects later on. And so then the department, it was fascinating. I was sitting in my fellowship. I was seeing patients in a fellowship one day, and I got a call from the dean. Wanted to set up an appointment to come to see him in my office, in his office. And my first thought was, boy, what on earth did I do to get in trouble to get someone to the dean's office? And so Bob Stone was a pathologist. He was the dean then. And he called me in and he said, there's this new specialty called family medicine. And they're training the kind of doctors that we need to be training for the state of New Mexico. I want to offer you a job to start a residency. And I thought about that. I got to think about this, because I had a dream 5 years before that even of going back to Central South America someplace and training generalists. Before I'd even heard of family medicine, I was working in a little mission hospital in Puerto Rico, and I said, here I am learning a new language in a strange culture. The graduates of the University of Puerto Rico are all going to the States and becoming subspecialists, and they can't come home. And they're not coming home. We need to train somebody to work in this little 40-bed hospital with 4 doctors like I'm doing. So I had that dream. And I remember sitting in the dean's office that day, and I said, my gosh, this is what I thought about that night after my 6th delivery in the middle of the night in Puerto Rico 5 years ago. He's offering me that job. And so I had I decided I didn't want to be a subspecialist. I had the training, I had some new credentials. But I really started studying about family medicine, studying about what it is, what it could be, what it could do, the kind of doctors I could do. And I said, this is exactly what I want to do. So I dropped the specialty track. I did finish the fellowship, and but then they hired me the next July on the faculty in the department. Bob O'Season, in the meantime, had left to go be head of the public health school in Houston. And it left our department without an epidemiologist, with community medicine activities. And so the dean said, tell you what, it'll be much easier if we just rename the department. We'll give you the department. He hired Bill Weiss to be the chair of Family and Community Medicine. We'll change the name to Family and Community Medicine. And I offered Bill the job as chair and you the job to start the residency, and we'll go forward from there. So that was how my first inkling. It was not well planned. I hadn't done a study to document the need for family doctors in New Mexico. The dean offered me a job, and I said, gee, that's a dream. I'll do it.
You were a visionary for the super generalist need of our country.
It really was. It led me to study who were who was teaching family medicine. Where were the programs? When we got ours accredited 2 years later, it actually. I think we were 69 or something like that in the chain of residencies that had been accredited.
And the year that he called you into his office?
That was 1971.
1971.
And we finally got our accreditation in 1973.
And how has the department grown since then?
Oh, it's grown tremendous. I mean, logarithmically. If you would have asked me in 1971 where it would be in 2019, I couldn't have even envisioned it. I just couldn't have imagined it. We were starting in a little, we didn't have a clinic. I didn't have patients. I was studying and reading about people who were writing about family medicine. I bought a book by a guy named Bob Rakel, who gave me some vision. He amplified some of the things, what family medicine was, what the education was. I visited a couple programs, one in Utah, one in Santa Rosa, California, saw residency programs. John Guyman, who became chair at University of Washington, still flying his own plane out to Port Angeles and the islands and west of Seattle. Took me under their wing and taught me about how to start a residency and what it took. They introduced me to the regulations of the Residency Review Committee, what you had to do, and that was the first year. Yeah. I had to raise funds. We didn't have any money. I had a salary of $15,000 for my salary. We had the existing salaries in the department, but nothing else. But first we needed a clinic. So during that first year, while I was trying to learn about family medicine, trying to learn something about teaching, learning about administration, writing some grants, trying to develop funds, and so I started a little practice, a little one-man practice. Since I had done a medicine residency and a fellowship, I had friends in internal medicine. The associate chair gave me one room in the internal medicine clinic, and we put a sign up. It was so high that people wouldn't notice it. It said, Family Medicine Center, Warren Heffron, MD. That was it. But I saw patients in that clinic during that first year started developing families. And people looked, well, what are these kids doing in this clinic? Looked at scans, but nobody really recognized what I was doing during that first year. And I'm sure there are people in the department, if they'd have seen that sign, they would have just died of apoplexy.